Hello, everyone. My name is Anand Singh, and I'm a rising fourth-year medical student at the Ann Burnett Marion School of Medicine at TCU in Fort Worth, Texas. I'm also an A.G. Jean Capello Health Advocacy Fellow for Doctors for America this year. Today, I will be speaking to you all about addressing the firearm violence public health crisis, my capstone project. A little bit about my advocacy journey is that it formally began in California during my undergraduate years, where I was able to join the National Alliance on Mental Illness, or NAMI, as a volunteer. Through this organization, I was able to gain firsthand experience advocating for state policies and state bills, which aim to increase mental health care access to all individuals in California, regardless of their socioeconomic status. This was something very personal and near and dear to my heart, and I knew that this was something I wanted to do moving forward in my career as a physician. So therefore, whenever I began medical school back in the state of Texas, I was able to join organizations such as the American Medical Association and Texas Medical Association, where I was able to draft multiple policies which really focused on firearm violence prevention, as well as other issues such as street medicine. Another group I was able to join was the American College of Preventive Medicine Advocacy Committee. Through this organization, I was able to really focus in on health promotion and disease prevention. Lastly, I was also selected as an Albert Schweitzer Fellowship. This fellowship gained me firsthand experience into my own local community and really exposed me to the health disparities that existed in my own zip code. These experiences have really shaped who I am today, and it's the reason why I applied for Doctors for America's Health Advocacy Fellowship. Now, through this health advocacy fellowship, I knew that I wanted to focus in on firearm violence prevention. How I went about this was that I had two main goals. One of them was to really focus in on creating an official coalition of medical students from across the country who are focused in on firearm violence prevention. The other goal was to really become a leader in this space and become Doctors for America's Gun Violence Prevention Committee co-chair. Both of these opportunities came with so much work and hard work and dedication, but I wouldn't take any of it back because it was great experience and I hope to continue it on. So why firearm violence prevention? Unfortunately, in my own medical school, our curriculum and education had been impacted by firearm violence. There was an unfortunate shooting in Methodist Dallas Hospital where our own students rotated at. This impacted their rotation there, and all of these students had to immediately be taken out of that hospital and be placed into different hospitals because of the situation that was going on. Speaking to my classmates who were actually at the hospital during the shooting really spoke to me and really tugged at my heartstrings, and I wanted to be able to enact change because of my experience in advocacy and policy. Similarly, the Uvalde, Texas shooting at Robb Elementary School that was broadcasted to the entire nation showed me how truly is an issue that impacts anyone and everyone, and how I, as a physician, have a duty to really address this issue. My first goal was to create the Medical Student Gun Violence Prevention Coalition. Through this coalition, I was really hoping to get connected with medical students across the country and empower them to speak out on this issue. So fortunately, through the skills I've been able to learn through this fellowship, such as how to write an op-ed, I was able to empower my own members of this coalition to write op-eds from across the country. Here's one example from the Indianapolis Star. Additionally, my second goal was really focused in on building my skill set in gun violence prevention and doing that through Doctors for America. Therefore, I was able to be the steering committee lead this year along with Danny. You can see here we helped organize the advocacy grand rounds where we were able to discuss safe storage. These experiences really showed me how important it is to speak up on these issues. And the skills that I learned through the Advocacy Fellowship, I was really able to utilize those skills in the real life and on these skills to achieve my goal. Lastly, outside of these two goals, I was also able to empower medical students from across the country through Doctors for America, where I was able to speak to an audience of medical students about how they can get involved with advocacy and specifically through Doctors for America. Finally, I wanted to close it off with my future directions. Now, knowing that I have these skills and tool sets, I really hope to continue building on my advocacy skills in this space on a statewide level and a national level. Thank you, Doctors for America, for this opportunity, and I'm forever grateful for it as it will impact my career. And I would like to close it off with my quote, "There's unity in diversity." Thank you all.